guys, it's Dr. Rob Gregory from Longevity Health and Fitness. I wanted to talk today a little bit more about the scheduling or needs of chiropractic care. I had a conversation with a woman the other day who spoke to me and said she just recently started training with me and said she had just started with chiropractic care with another provider, which, we started talking about it, and I said, we tried to work out a schedule for personal training. And as we spoke, she said, well, I'd like to do this as often as possible, but unfortunately I just started with a chiropractor, and that's going to take up a lot of my time as well. And I just, out of curiosity, asked how many times this chiropractor had prescribed her to come in for her chiropractic treatment. This individual has long-term degenerative arthritis. She has osteoarthritis in the lower lumbar spine, very mild postural differences. She has a little bit of anterior head carriage, a little bit of upper cross type syndrome, where she has a little bit of deviation in her cervical curvature, a little bit of hyperlordosis, but some mild degeneration of the lumbar spine and a little bit in the cervical spine. The prescription that she had been given was 12 weeks at 3 times a week for chiropractic care. Now, I am a more conservative chiropractor than most. I do believe that sometimes there are needs for 3 times a week for a few weeks, maybe twice a week for a lot of folks. With most things, though, I believe that there's a fitness-first approach. And unfortunately, she asked, she'd never had chiropractic care before, and she asked me, she said, I don't know, is this enough? Is this too much? Whatever. I did let her know that, I don't know who she's seeing, but I did let her know that, you're on the upper end of the spectrum as far as how often you need to go in. For a long-term chronic disability, chiropractic care is not going to completely eliminate your degeneration. Now, it may help with the current flare-up she has acutely with the degeneration that she's experiencing, and chiropractic care can absolutely slow down degeneration. But to reverse or eliminate the degeneration that she has currently, going 3 times a week for the next 12 weeks for 3 months worth of care, that is absurd by any stretch of the means, and that's an abuse, unfortunately, in my opinion, of chiropractic care. If she were in an auto accident or she had an acute trauma, you know what? Now we're talking about a situation where multiple visits are absolutely going to be necessary. While we talk about that, a lot of people seek chiropractic care for post-injury or post-accident type of care, and that's a fantastic way to approach your care. Those are types of situations where more care is going to be necessary more frequently. But when you're starting to talk about trying to get care that is supposed to be corrective or preventative, that type of care, most of your preventative time, your frequency should be spent in the gym doing exercises to balance the body. The rest of it should be spent doing some of your mobility and corrective postural things, which chiropractic is absolutely a part of. The chiropractic care in that respect can usually be used if there's an acute flare-up that caused you to say, gosh, now's the time to do something before it gets worse. Then yes, your chiropractic care may take a forefront in that, maybe twice a week for a few weeks until you get things resolved and either asymptomatic or less of a, I feel it kind of thing. But after that, once every 3 to 6 weeks is a great way to add preventative care from a chiropractic perspective into the whole of your programming, both your soft tissue work, foam rolling, getting massages, getting stretched, as well as your strength training and cardiovascular training. Chiropractic absolutely plays a role in your normal fitness routine for preventative maintenance. But 3 times a week for 12 weeks is not a great care plan for somebody that is looking to get rid of a chronic condition that's just kind of acutely flared up. That is a lot of chiropractic care for an individual. So just because I have this specific thing, I just wanted to make a note for you guys. If you have any questions about that, feel free to let me know. Email me, give me a call. But fitness is at the forefront of your prevention. Chiropractic is absolutely a part of your preventative health care, but it needs to play the appropriate role depending on the person, their injuries, their health history. If you have disease processes going on, it may be more frequent than that. If you have a chronic acute issue, kind of like sciatica because of a disc herniation or something like that, now we're talking about you might need weekly maintenance. And that's something that is going to be determined based on how well you respond to treatment and how long that lasts for you. And then you create the care plan according to how you feel. I hope that kind of helps sum some things up for you guys about your fitness. Remember, movement is the medicine. Feel free to call me or email me or stop on by to 1171 Commerce Drive at the Longevity Health and Fitness Studios.